Welcome to another Founder Wisdom podcast with Paula Muto. Paula's an MD. So basically, she's been doing general surgery for the past 30 years, which is quite a lot. First at Muto Surgical, then vascular surgeon at Muto Vein Center. And then we're going to talk about Uberdoc today, which she is founder and CEO at. So it's going to be an interesting podcast, to say the least. This podcast brought to you by my podcasting agency. It's called podpair.com. If you want to start, scale, or be invited to podcasts like this one, you can go to podpair.com. Paula, welcome to the pod. Tell me a bit more about yourself, your career, and Uberdoc.
Certainly. So first of all, thanks for having me today. Really nice to be here. So I am a surgeon, like you said, almost by birth. My father was a surgeon. My brother is a surgeon, two uncles, and I'm married to a surgeon, all in Massachusetts for a collective century. So I've been on the front lines of healthcare, and I love what I do, and I love taking care of my patients. In the past, decade or so, U.S. healthcare has kind of gone off the rails, and I saw it firsthand. And I thought, wow, maybe we can do something to kind of change it and make it easier for patients and easier for doctors. So it's about 7.5 years ago, we created a platform called Uberdoc. We had the idea, we conceived it, we launched it. We have over 5,000 doctors across the country, in every state, in every specialty, who are now available to patients nearby and available to see them for a transparent price. So we're trying to offer patients this great alternative, and it's been a very, very exciting journey.
Tell us about your surgeon career first. Veins, I'm not familiar with that field. Tell us a bit more about what is it that you do.
So I trained in general surgery and did a subspecialty in vascular surgery. So for, I guess it is close to 30 years, I've been operating on patients. So taking care of all sorts of patients, from trauma to, cancer patients, but my specialty is vascular. So management of arterial and venous disease. Over the years, arterial disease has changed and has been treated more with balloons and with medications like statins. Venous disease is a chronic disease. 30% of the population gets worse with age and obesity. And I've become an expert in it because I've taken care of it for 20 plus years and trained with probably some of the best people in the world in veins. And the venous procedures and treatments are so good right now. All office-based, low cost, low risk, high tech. It's sort of given me the opportunity to do a lot of high-end sort of treatments right in the comfort of my own office, where patients can come in and out and get treatment and go right back to work, which is all the beauty of technology. That's, I think, some of the reason why I like Uberdoc was because I wanted to make patients, the healthcare system match the technology that medicine offers.
So I had a cardiologist on the pod today. So the heart pumps blood in these veins transport these red blood cells rich with oxygen and other nutrients to relevant places in the body. And as I was using my compressor boots today as an ultra athlete, I felt I squished my legs a bit too hard. So I guess a vein could have popped there. How important are veins in the body? What are veins first? Like they're weird kind of tissue.
Sure.
And what is their role in the body?
So the heart pumps the blood to your extremities, to your legs, right? And then the blood has to get back to your heart. And if you're standing, it has to go against gravity. So how does blood go from your toe back to the heart to be oxygenated and pumped back around? So there's two ways that happen. Your calf is actually a pump. So as an athlete, every time you walk or run, your calf is pumping. So your muscles squeeze the veins. Veins are tubes, they're blood vessels. So the blood goes up. And then there's a system of little doorways or valves in place. So what happens is that you're born with good valves. The blood goes up, the door closes, and the blood stays north and gets back to your heart. With people with chronic venous disease, they inherit a sort of loose valve. So from birth, it doesn't work very well. And then you add pregnancies or weight gain or age to that. The veins, just the valve opens, and then the blood comes up and lands back down at the ankles. And over a long period of time, those ankles can get swollen. The legs can get very tired at the end of the day. Patients with venous disease feel like their legs are brick. They're really heavy at the end of the day. And they can begin to discolor. And it's when they start to discolor that the problems come up, because you end up with potential for wound complications. And I live my life in a wound center along with my husband, who takes care of lots of wounds. And as patients have been aging longer and longer, you're seeing more complications from the venous disease. I like to tell my patients it's like living in a house with a leaky pipe, and you go to your basement carpet and it's a little bit wet. And it's like, but you can replace the carpet, but ultimately it's the pipe in the wall that needs to be fixed. But it all depends how long you're in your house. But now people are in their house till age 100. So venous disease has become more important to be on top of. And again, the treatments are safe, they're inexpensive, and they're extremely effective. And they're all outpatient office-based.
What are these treatments? Are these drugs? Are these like physical rehab, or these surgery? Like, tell us a bit more about that aspect.
So when you look at a patient with venous disease and you make the diagnosis, and I should say restless leg syndrome is a big symptom of this disease as well. When patients at the sort of like, once you identify a patient with a family history, they have that heaviness, they try to go to sleep at night, their legs don't settle down. Those are patients with venous disease. We work them up with, say, ultrasound, and we find those valves. So what are the treatments? Well, if the valve is leaking, you can treat the vein with ablative techniques. And people also have traditionally given patients compression stockings. Compression stockings are really only good for patients with swelling. They're only for symptom control. They don't actually close the valve or reverse the problem. They're just for symptoms. There's no real pill to take. Patients of mine come with all sorts of medications for venous disease. There's a lot for restless leg, tons of medications out there, ropinirole and Neurontin and gabapentin. And if the restless leg is related to venous disease, treating the vein treats the disease, and these patients come off those medications. And that's when my patients kiss me when that happens. So most of the treatments for venous disease are, yes, skincare, compression are sort of the mainstays of patients with insufficiency in the deep system. Superficial system is treated with what we call ablation or injection or phlebectomy. There's a number of different ways that we can treat veins.
You've seen the US healthcare system firsthand. What problems have you felt in your practice, and what would be potential solutions for these?
So I think the biggest issue most physicians encounter are obstacles. It's just too complicated to do something that's fairly simple. Again, we are faced with these technologies, which are better, faster, cheaper for our patients. Yet we're told to kind of follow these pathways that are very complicated and expensive in bringing patients back multiple times, because that's how insurance dictates the equation. So that is the biggest obstacle I think people have, is to try to get the patients, to optimize their therapies with these very good technologies without constantly involving a middleman. I think that most doctors will tell you the cost of doing business is exceeding the cost of the business. In other words, the cost of care isn't that expensive. It's the cost of like getting the pre-approvals, the authorizations, and you're paying all these middlemen way more than the treatment costs. If you order an MRI, it's like $450, but you're paying thousands of dollars in pre-approvals to get that $450 MRI. It's just not any value. It's not valuable, and it's dangerous.
What would be potential solutions to all of these problems?
I think transparency. It's not that hard. Physicians that join our platform are willing to be transparent. By transparency, I mean telling you what the price is. I don't think there's any reason we have to play games. with when a patient asks how much it's going to cost, the answer should be, I don't know, depends on your insurance. That's silly. How much, I'm you're buying, you're going to a restaurant, you order something on the menu, there's a price. There should be a price for everything, and there is a price. It's not a mystery. But it's been intentionally opaque system, so that the middlemen cannot tell you the price and can bargain for the price. And when you have opacity and lack of transparency, no one really knows what the price is.
And tell me about Uberdoc and how you're facilitating this whole process.
So our premise with Uberdoc was that getting closer to definitive care was important. In other words, if you have twisted your ankle, if you could get into an ankle doctor as opposed to go to the walk-in, get an x-ray, go to the primary, get referred, that's a lot of time. Could we not shorten that time? I mean, it's your shoulder, see a shoulder specialist, but there's this sort of sense that specialists are going to be more expensive. So we took that all apart and said, we're going to give you a transparent price. We're going to make it less expensive than insurance. We're going to make it cash, affordable, and we're going to pay the doctors, or the doctor's going to get paid immediately. So it's a win-win for the patient and the doctor.
Love that. So how do you make sure that this company keeps on growing while you maintain your surgeon practice? So
it's always been really important to me to stay in front of patients. I've cut my practice back significantly. And again, it's a very niche elective practice now. And I have a phenomenal team of people and nurses that take care of me and my patients. So I'm very blessed. But I have to say that to grow Uberdoc is really about partnerships and awareness. We have, a presence online. You can spend billions of dollars to make that presence louder. When we have, opportunities to be loud, we are trying to be loud. I always like to say Uberdoc is the best kept secret, because people are like, oh my God, I didn't know, but I've always wanted this ability to do this. Our network is big, but it's not everybody. I want everybody. I don't think there's a doctor out there that should not be an Uberdoc. Whether they're employed, whether they're a specialist at an institution like the Mayo Clinic, or whether they're a rural OBGYN, or they're a family practitioner in Oklahoma. They should all put aside a seat for a direct pay patient, because I think that just makes sense. That's the right thing to do. This world needs to be more transparent.
It does. So what would be your main goals for next year?
So next year, we are ramping up very quickly. We have a couple of government contracts, believe it or not. The government seems to think that we're like, they need to make appointments, then they're coming to us, which is amazing. We are ramping up with employers. A lot of employers, we adopt the cost plus model, similar to what Mark Cuban's company does. We actually work closely with them, which is a great model, which is just a here we are for your employees. We don't charge employers subscription fees or anything. We just say, hey, if your employees have health savings accounts, if they have cash accounts, they should be using Uberdoc as a way to get faster access to specialty care. And so we do that all through a completely transparent model. So we have a lot of exciting partnerships coming up in 2024 that will be able to kind of get Uberdoc more out there into the public.
Mark Cuban's company, can you tell me, I believe it's called Costless or something like that?
Cost plus, yeah.
Yeah, tell me a bit more about their model, and what do you think it can do social good, but also be a multi-billion-dollar company? So
our model, like I explained, was we don't use insurance, right? That you don't need the prior auth referral, the authorization. You're just paying the doctor straight, and the doctor is like basically getting paid, and the patient is just paying directly with it, and there's a transaction. In Cost Plus, their patients are just buying the medication at the cost plus 15%. That's it. There's no other markup, and 15% plus shipping and handling. So they're being 100% transparent with the cost of medication. Much like medical care, no one knows the price. Pharmaceuticals are also governed by the insurers and what we call these pharmacy benefit managers, who are the middlemen. And the middlemen decide what the price of the drug is. So you could have the same drug, and 3 different patients paying 3 different prices for that drug. And that's just coming off the assembly line. So it's the same concept as Uberdoc in the sense that there's really no excuse not to have a transparency. There's just no excuse. You don't have to set the price in every state that you're in, because things might be different from state to state, but honestly, the price needs to be transparent. It's the transparency that's the most important thing. And when you're buying a drug from a company that comes from a factory, there's a price associated with that. The fact that it goes through so many hands and increases, and I can tell you, my patients cannot afford their drugs. And every day that Mark Cuban adds another drug to his list is a good day for my patients. And we send that out to our network almost, bi-monthly basis. We ask for that list and we give it to our doctors and we say, these are new drugs that are now available.
Why did it take so long for a company like that to take shape? Here in Mexico, there's Similares, which is like a pharmacy chain, Simi, and they've been making like the generic version of the drug for multiple decades now, 2 decades to be precise. Why do you think it took so long to arrive in the US and potentially Canada?
Because the entire US healthcare system has been heavily subsidized, for insurers to be the main distributor and the main manager of healthcare, right? That it sort of starts from the idea that individuals can't manage their own care; they need help, and the insurers were given all of the control of that. So when you have a massive industry that is now the #1 employer in 48 out of 50 states is in fact healthcare. It's the #1 industry. It's very hard to challenge that or change that, right? So to come along with a model that's disruptive, it disrupts more than the industry. It can threaten jobs and livelihood and political clout. However, medicine changed. It changed. This is, healthcare. It would be great if it stayed in the 70s and 80s when we admitted everybody to the hospital and kept them safe for 2 weeks, right? It's just technology changed this whole equation. So we cannot go backwards. We can't sustain this. We must have something new. And patients can go to Mexico and get their medications. They can go to Canada and get their medications. They're saying, why then can I not get them in my own country?
Why do you think that healthcare system has not scaled fine? And yeah, you've seen that disruption around a decade ago. Is it because there's more population? Is it because there's new ills that are appearing and the quality of life tends to be increasing? And why do you think that's not also unique to the US? Canada also has big problems on that level.
So I think that what we share with other countries and challenges, and with COVID, I think that's a perfect example. It was like the Olympics of medicine, right? Is that we do have longevity. We have an aging population around the world. More and more people are living in their 60s, 70s, 80s, and they will have more diseases. They will have more arthritis. They'll have more cancers. Ironically, they're living longer because they're not getting as aggressive heart disease, which, because smoking rates are down in the US, you can't smoke publicly, and also because of statins. So there's medical technologies. So everyone has that issue. What makes the US unique is that, there are other countries that have government-run healthcare, but it's 100% government run. The US has government subsidized healthcare, and it's given over to the insurers. So the insurance companies are the ones receiving the lion's share of the healthcare dollar, and it's not trickling to the patients at a time when the patients have to access this unique, personalized medical care. I mean, if you just think cancer therapy, right? Cancer therapy used to go to the hospital. You'd be admitted, you get induction therapy, and everyone pretty much had the same 3 drugs for every cancer out there. Now there's like 3,000 drugs, and it's only going to be good for maybe 10 people or 100 people. So those drugs are never going to scale from a profitability standpoint, but from a technology standpoint, it's phenomenal. It's your genetics that are determining that prescriptive, right? That drug. So when you have medicine, again, I keep saying healthcare, medical care evolving so individualized, the global one size fit all models no longer hold. And that's probably the same challenges you're having in other countries with nationalized healthcare. Is like, what do we do? Things change too fast. But everyone's worried the price is too high, but the price actually came down. The insurers are keeping it artificially elevated.
What do you think about characters like Martin Shkreli that are buying companies and raising the prices of drugs to 1000x?
So I think that drug companies get vilified all the time because they're pharmaceuticals and they're trying to make millions of dollars. They have their ways of making lots of money. Again, the perfect cancer drug will never scale. You look at Humira. Humira is the greatest product ever made. It's only good for 300,000 people, but it's made $90 billion. So you got to ask how. Like, how is this even happening? Is this really even real? I think that in this country, the drug prices are governed entirely by the middlemen insurers. So the insurers will set the price as high as they want it so that you buy the insurance to have access to that drug. Think of it as like the tolls, like they're paywalls behind these drugs. The latest drug out there, the semaglutides, are going to be as impactful in cardiovascular and obesity as the statins were for heart disease. And they should not be held behind paywalls. These are life-saving medications that improve people's quality of life, decrease their risk for kidney failure, heart disease, and reduce obesity, which is our number one disease. Now, obesity is the number one disease in America right now. So to hold that life-saving medication behind a paywall is unethical.
Last question, by the way, because I know we're on time. Why do we need all these middlemen? Like insurance, I feel it's just like mental peace, right? And we know that stress is a killer. So I can see the potential value here. Me, I don't have much insurances. I have my own insurance of taking care of my own health and knowing that I'm able to survive and thrive in pretty much any situation, which sounds very arrogant, I know, but I'm deep into the biohacking world. My first business was a health tech, quote unquote, business. Why do we need insurance? Why do we need the government as a middleman? Is it because we're not all Charles?
So insurance is important because people have unexpected illnesses that will in fact cost more than, even if it's totally transparent, will still cost more than you expect, right? You get car insurance because you could bump into something you need to repair your car, right? But you don't use your car insurance for your oil change, right? If you did, the price would go way high. So health insurance is important for those catastrophic events or those unexpected, or those pregnancies or something that's going to occur episodically that you're going to need coverage. And of course, if you have renal failure, cancer treatment, those should all be covered always. Those should be like basically Medicare or government covered. I think that the problem with that is that we're using insurance in the United States for all these sundry, like the small things. We're asking you to pull your insurance card out to just see your doctor's visit, see your pediatrician. I mean, these appointments are low cost, and they could be handled in a much more efficient way, even through a health savings account, through just an insurance card with a magnetic strip, for God's sakes. Just like use it as a credit card and have it paid for, because this business of billing, collecting, processing claims, a lot of data gets lost in that. It can't be protected. And there's a middle in all of that doesn't need to happen. So I think that you do need insurance. You just need to apply it in the appropriate manner. And right now in the US healthcare, we apply insurance to too many transactions that don't require insurance. And it's very costly for both the patient, the doctors, the taxpayers, and I would say the government too.
Paula, thank you so much for the interview today. Where can people find out more about you?
So if you want to find out about Uberdocs, you can go to uber-docs.com. That's our main website, or Google Uberdoc. I'm at Paula at uber-docs.com, so it's easy. If anyone wants to reach out to me directly, I'm on LinkedIn as well as Paula Muto. I'm very happy to talk to people. This is an effort of love, actually, to be able to change the system, to let people know that there are people out there in the system who are looking out for you, and so we can kind of put healthcare, put medical care back on track.